They're not comparing countries. They're comparing pathways. So when some Americans start looking at China for healthcare, they're asking, is there another way to get answers faster? Is there another way to understand the cause earlier? Is there another way to complete more steps in one trip? Is there another system that can turn uncertainty into a plan? This is where China becomes interesting. China's healthcare system is not perfect. Large hospitals can be crowded. Doctors may have shorter consultation time. There are regional differences. For foreigners, language and process can be difficult. But in selected, planned, non-emergency medical services, China may create a different balance point inside the healthcare iron triangle. Why? 3 reasons: scale, concentration, cost structure. First, scale. China's healthcare system handled 10.15 billion patient visits in 2024. China is not low-frequency medicine. It is high-volume medicine. Scale does not automatically create better medicine. But for high-frequency semi-standardized services, physical exams, ultrasound, CT, endoscopy, dental work, routine specialty consultations, volume creates repetition. Repetition creates workflow. Workflow creates speed. That is what I mean by clinical experience density. The second reason is concentration. In the US, the patient journey is often fragmented. Even with a PPO, a patient may move from primary care to specialist to imaging center to lab to insurance approval to EOB and finally to the bill. In China, the path can be more concentrated. A hospital or health management center may place physical exam, blood tests, ultrasound, CT, endoscopy, report printing, and doctor review inside one coordinated environment. This does not mean every patient can finish everything in one day. But with the right city, the right hospital, the right project, and advanced coordination, several medical steps can often be compressed into a few days. That is very different from the American experience. The third reason is cost structure. But compared with the US commercial insurance market, China has stronger public payer purchasing power, government-guided pricing, and centralized procurement. That changes the cost structure. It lowers prices in some areas, but it also creates trade-offs. Crowded hospitals, shorter doctor time, pressure on medical staff, and uneven service experience. So again, China is not perfect. It simply creates a different balance point. But here's the real problem. The hard part is not just flying to China. The hard part is knowing which city, which hospital, which department, which doctor, which tests, which documents, which translation, which risks, and which cases should not come to China at all.